NBC 10 looks into the impact of possible cuts to Medicaid. This week, the House passed a budget resolution which would slash $2 trillion from that budget over 10 years, and that move could bring significant cuts to Medicaid.
And in cities like Woonsocket, nearly half of the residents there rely on Medicaid for their health care. Health Check 10's Barbara Morse reports on how health officials in that community are pleading with lawmakers to fight for Medicaid.
Definitely a concern for us.
Michael Souza is the CEO of Landmark Medical Center.
About 40% of their population gets some form of care from Thunder Mist.
Matthew Roman, the CEO of Thunder Mist, a community health center with 4 locations, including Woonsocket. More than 40% of their patients at both institutions are on Medicaid, both concerned about proposed state cuts.
That probably has an impact of about $1 million to Landmark.
Tack on possible federal cuts.
More people will have trouble accessing care. And when people can't access the appropriate care, their conditions often progress, and then they require higher, more expensive forms of care, like a hospitalization.
When, most of your funding is coming from the federal government, because most of our patients are either Medicare or Medicaid. You could have limited services, you could have longer waits in the emergency room.
What is your message to our lawmakers, both state and our federal lawmakers?
I think the message is that Medicaid is the safety net insurer that our most vulnerable community members rely on.
Affecting to the growing need for behavioral health services.
Last year, we delivered 330,000 outpatient visits. 1 in 7 of those visits, about 70,000 visits, were behavioral health visits.
They're hoping lawmakers hear and act on this message. I'm Health Check 10 reporter Barbara Morse.